members of the head table, ladies and gentlemen, thank you very much once again for inviting me. And I enjoyed this conference, and it's great to be part of it. The topic that the organizers have given me is undergraduate and postgraduate assessment. And to do justice to this vast topic in 15 minutes, I thought I should do something sort of different. So what I try to do is try to see what people tell about assessment. When it comes to exams, everybody, whether it's postgraduate or undergraduate, every person will have an opinion. And sometimes people demand opinions. How was the exam? And you're not okay if somebody says, yeah, it was okay. That you don't like. You want some opinion, a strong opinion. And it's more so when you ask opinions from the failing candidates. So I thought of looking at what do the failing candidates say about exams. I gathered about 5. There may be more, but I gathered some important comments that failing candidates make on assessment. What are they? I failed because I was not up to the mark. Fine, that's one. And next one, the entire exam was on a little bit I did not study. Everything else I knew, but it was not examined. Number 3, these exams are good for bookworms. Too theoretical. That's why I failed. Number 4, it was a bad day. I got a difficult patient. Or I got a strict examiner. But whereas the other person didn't get this. And he passed, I failed. Too bad. Finally, exam was too difficult compared to the previous years. I would have passed if I sat last year. These comments, by and large, may not be always true. They may be sometimes excuses. But yet, I think we in medical education and we who set exams will have to take note of them and see whether we can, at least if somebody says it, with evidence we can say that no, it was not so. You failed because you didn't know. The first comment. So let me take one by one and see how medical education has tried to address these comments. Number 1, which is easy. What should we do? We need not do anything. In fact, we should be happy. Happy not for the reason that the candidate failed, but for the reason that our exam has picked up a candidate who didn't know and has failed it. And also, on the contrary, our exam has also picked up candidates who knew and who were competent, and we have passed them. So we need not do anything. But every other comment that I am going to discuss, we have to do something. Whether they are true or whether they are not true, immaterial. Second comment, the entire exam was on a little bit that I did not study. Everything else I knew, but they were not examined. What's the problem here? Well, we had a large curriculum. Of course, we couldn't assess everything, but we have assessed only a tiny bit, not the entire curriculum. So the exam has not included a representative sample of the curriculum. What are we going to do about it? We need to adopt a technique called blueprinting. And what is a blueprint? Blueprinting is a very simple grid or a table which have all the topics that one needs to learn, which the topics that are in the curriculum in rows, and in columns, all the competencies that people have, the curriculum suggests that the learner should master. And the trick here is, when we fill this blueprint, we need to ensure that each row and each column is at least represented once within our exam. Then a candidate will not be able to say, okay, I didn't know only a little bit, and everything that I was examined on was on that, because that cannot be told, because everything has been examined at least in a small way. Okay, let's move on to number 3. These exams are good for bookworms, too theoretical. What's the problem here? We have to ask ourselves, have we assessed only through written assessment? In that case, this may be true. Or did our exam system had a multiple tool. It's a toolkit of exams, multiple exams which assess a lot of things. For that, what should we do? We have to assess all levels of Miller's pyramid. Well, if you came to the Hoover Memorial lecture yesterday, you would have got something on Miller's pyramid. For those who didn't come, Miller said that all assessment can be categorized into 4 levels. Nose, which is at the very bottom, is about simple recall, and we can use our traditional written exams like essays and MCQs for that. When for knows how is application of knowledge, that we need a special type of MCQs called extended matching items and scenario-based single-based answer questions, and of course structured essays and all that. Then for shows how, which means that the candidate should be able to show a skill to us under examination conditions, and for that you will have to have any scenario-based objective test such as an OSCE. And finally, you can do all that, but a candidate can pass an exam with flying colors and then go to the workplace and be a lousy doctor. And to prevent that, people have found that you have to not only assess under examination conditions, you have to assess a person under his natural workplace conditions. And for that, you need to assess at the desk level. And for that, now we have a gamut of tools, portfolios, logbooks, and a whole variety of rating scales such as DOBS, Mini-CX, and multi-source feedback, which are basically rating scales, which where the rater will have to observe the candidate and give a rating on various competencies. Right, so if we did that, and if we ensure that our exam had all this, then a candidate cannot complain that these exams are good for bookworms. There is a second aspect to this, and that is still the exams, about the complaint that these exams are good for bookworms. Even within the written domain, somebody might say, anybody who can mug up and regurgitate can pass. What is the problem there? Even within written exams, have we assessed only recall? Or should not we assess what we call higher order thinking? All these speakers talked about the reasoning skills and the need for doctors to sort of swim through a sea of information and get at the correct diagnosis. And for that sort of things, you have to test them. Otherwise, people don't master them. So then what should we do? We should not only assess all levels in the Miller's pyramid, but within the written domain, that is the knowledge domain, we need to assess not only recall. And for that, we need to assess all levels of what we call the Bloom's taxonomy. What is Bloom's taxonomy? Bloom and colleagues long time ago, I think in 1956, categorized, not only in medicine, but any learning, they categorized into 6 levels, and these are those 6 levels: knowledge, comprehension, application, analysis, synthesis, and evaluation. And traditionally we have been assessing only recall and very few application and comprehension. But really, if we want to see a doctor who can really diagnose and really tease out difficult pieces of information, put together and come up with a diagnosis, then you need to assess at higher levels: analysis, synthesis, and evaluation. And for that, we need to have special techniques among the written exams, such as extended matching items and scenario-based, single-based answers. Are we doing it? If you are doing it, then the candidates, I don't think it's fair for the candidate to say that these are good for bookworms. These exams are good for bookworms. Number 4, it was a bad day. I got a difficult patient, or I got a strict examiner. What's the problem here? We have assessed the candidate only with one patient and one examiner, and confined to one occasion. So there's too little sampling. So rather than assessing the candidate and giving the candidate a chance to prove himself over a long period of time, we have taken a snapshot of the ability of the candidate, and we have judged the candidate based on that snapshot. Whereas it should have been a video. That means assessing the candidates over a long period of time with lot of patience, with lot of examiners. And for that, we need to move away from these one-off exams and to have a series of exams. And at SHOSAV level, we have the scenario-based objective exams such as OSCE. And at DUS level, we have the workplace-based assessments, the rating scales that I was talking about. Right. Number 5. Exam was too difficult compared to previous years. I would have passed if I sat the last year. What is the problem here? Well, the pass-fail standard does not correspond to the difficulty of the exam. So 1 year, we had a difficult exam and still the pass mark was 50%. And the next year, we had somewhat an easy exam and still the pass mark was 50%. And then this problem may crop up. So what should we do? We should do is to adopt an appropriate standard setting method. What are standard setting methods? They will set the pass mark in many different ways. You can set the pass mark criterion reference, norm reference, or compromise. Criterion reference means that I set the criteria as a global consensus, a set of examiners, and if all students pass or all students make the mark, everybody will pass. If no student makes the mark, then everybody will fail. Norm reference we use only for selection purposes. That is, a certain percentage of candidates will get in and will pass. Compromise is a combination of these two. And there are various methods. And you can also set the pass mark either for individual items or for the same or for the whole exam, what we call compensatory and conjunctive standards. Right. We can do another thing, and that is we can also be informed by what we call item statistics. That is, if we give an exam and if we get the marks, we can analyze them and find out what is their difficulty and what is their ability to discriminate the good students from the bad students. And if we have that information, then next time when we set the exam, we could be guided by by that information. So we can then appropriately bank the items and reuse it if necessary. Now, in summary, what do the failing candidates say about the exam? They are quite informative and they are quite instructional to us as exam setters. And these are the 5 things that I chose. There may be others, but these are the 5 things that I showed. For the first one, I failed because I was not up to the mark. An honest candidate and a candidate who has insight, very good. We need not worry. But if anything else is told, we have to have a relook. The entire exam was on a little bit that I did not study, and everything else I knew, but they were not examined. In that case, if we have a blueprint and if we ensure that our exam is according to the blueprint, a candidate cannot say that. These exams are good for bookworms, too theoretical. Then, to avoid such a complaint, we need to assess all levels of Miller's pyramid and Bloom's taxonomy. It was a bad day. I got a difficult patient or a too strict examiner. Assess more times, over time, in many contexts, including many patients and many examiners. Finally, exam was too difficult compared to previous years. I would have passed if I sat last year. That couldn't happen if proper standard setting methods were adopted and if we were informed by item statistics. Thank you very much.